This is a very unfortunate case. This is a 29-year-old diabetic patient who, up until recently, was living in Cuba. Llegate aquí el 16, ¿no?
Sí.
Back in Cuba, he had something fell on his right great toe. And apparently they removed his toenail because of the injury. And removing the toenail apparently led to that, and probably some other contributory factors led to infection. And the combination of the infection plus the diabetes plus the vascular disease, they went in and they took a little piece of the toe. And apparently the incision did not heal. So they went back in to take a little bit more, and they ended up essentially amputating the toe.
Sí.
And they were not able to close it. The amputation defect was left open to heal by what we call secondary intention. Let's take a look at the right first. So again, this is a 29-year-old diabetic patient who found out that he was diabetic in 2016. Now we have one big problem which we already spoke about. The patient smokes 1 pack of cigarettes, or almost a day, for the last 15 years. So he's been smoking since he was 14 or 15 years of age in Cuba. So, let's take a look at the bottom of the foot as well. No, so what we see here is we have a very large callus underneath the first metatarsal head. We have 2 other ones underneath the 4th and the 5th, and these are called transfer lesions because of this. It's been a long time since I've seen such a young patient with diabetes with such severe vascular disease. I want you guys to see something striking. I want Lisbeth, I want you to come over here. Okay, now, I want everyone to look at his left foot. Look at all of the redness. Okay, you see all this redness? By the way, this is from we already numbed the toe. He has he also has a paronychia, which we're going to take care of now as well. But at first glance, we look at the foot. It's all of the toes are red. Now, I want you guys to see something. I'm tilting the patient back. Okay, we'll wait about maybe 20 seconds or so. And the redness of the lesser toes is disappearing. A little bit on the great toe as well. Dr. Wagner, what does that mean? You see, all of it is gone. A little residual, but I would say 90% of it is all gone. If the redness was still there, it would mean that the patient has infection, cellulitis. But what I think is happening here is, until proven otherwise, let's bring it back down now. This patient at 29 years of age with the robust diabetes and the robust, the severe vascular disease, we're setting ourselves up here, unfortunately, for a complete catastrophe. And I already spoke to the patient about this. Smoking 1 pack of cigarettes a day, the diabetes, again, he did not know. For all we know, he may have been diabetic since he was 10 years old and he never knew it. Right? So he just told me again that he in Cuba they never worked him up for diabetes. So several years ago, that's when they found out that he was diabetic. Extremely unfortunate. This case has really hit me hard. The patient will be seeing our good friend, the interventional radiologist, the vascular specialist, the plumber, because he needs to be seen immediately. To see exactly what is going on in respect to the vascular supply to the left foot. Now, let's talk about the great toe. Vamos a moverte un poquito. Ok, muchas gracias. Extremely unfortunate. A month ago, prior to January 1st, the patient had no insurance. January 1st, patient has insurance. He decided to trim his own toenails. Unfortunately, as everyone, right there, he took a little, let me just clear that, there we go. By mistake, he cut himself. He didn't really realize what exactly happened at the time, then realized there was infection a couple weeks later. So then he had to go to his primary to get a referral to eventually make it here 3 weeks later. So the patient is currently on antibiotics, but he has, what we're going to go ahead and do on both sides, we're going to remove these offending nail plates on this side. Abi? This is extremely unfortunate, ladies and gentlemen. Look, an abscess. He's got, can we see that? He's got pus. I would not be surprised. Let's take a look at this side as well. Look at the size of this.
I know what you think about it.
My only concern, I just want to be very clear, I'll tell everyone now. This nail's basically just it's all brittle. It's just basically melted away completely and totally. So let me cut this a little bit here. Let's see if there may be a collection underneath here. Yeah, this is loose. My only concern, just like on the other foot, Dr. Wagner, why not remove the nail? Right? It is loose. See? You see that? But my only concern is that he may not have enough blood supply to heal even the removal of the nail plate. Which, let's go back a couple of years, that's exactly what transpired on the right. Even though he did have the injury, they removed the nail plate, and that was basically just the beginning of the entire, snowball effect. The moment of truth, I want to also do something now is, he's 29 years old. There's minimal bleeding. Usually we see a lot of blood. Come close. Let's see if we get a little trickle here. Estoy buscando ver si baja la sangre. Sorry. Marginal. Severe microvascular disease. Just like I told him before, if he was my brother, what would I say? In respect to the diabetes, we have to definitely get that under control, whatever it takes. In respect to the smoking, I already told him, if you continue to smoke, you will lose your legs. If you stop now, your life will definitely change for the better. We can only do so much. But again, it's been a very, very long time since I see a 29-year-old diabetic patient with such a robust case of, the deadly dual combo of diabetes and vascular disease. This is, my heart breaks for this young gentleman. People might be saying, well, he chose, he's choosing to smoke. I understand that element. He's choosing to smoke. He can stop. But it does affect me just because he's so young. He's already lost one, the right great toe. And now, the left great toe is at risk. I'm gonna see him back in 2 days. To keep a close eye on the clinical presentation before the weekend. I will keep